School shootings, violence, the pandemic have led to a teen mental health crisis. According to the CDC, roughly 4 in 10 high school students had feelings of sadness or hopelessness in 2021.
May is Mental Health Awareness Month, so the KVUE Defenders looked into what can be done to address the teen mental health crisis. Here's investigative reporter Jenny Lee.
Behind the walls of Huddle High School roam thousands of teenagers. Genesis Gonzalez is one of them.
It's going all right.
The junior is back to enjoying school in person.
Having the time of your life.
Belting out songs with her choir class.
Watch that scene, digging the dancing queen.
That wasn't always the case.
It was just hard just being alone.
Genesis spent part of 8th grade and her entire 9th grade year learning virtually from home because of the pandemic. That took a toll.
I didn't really have as many friends, so just seeing people's faces on a screen didn't help with that social interaction.
Social media made things worse.
I personally struggled with body image for a while, especially with the rise of social media. I think that was really hard, seeing what I thought society expected from girls, and I wasn't that.
Genesis says she withdrew.
I was really sad.
And struggled with her mental health. She's not alone. According to the Centers for Disease Control and Prevention, the number of high school students with persistent feelings of sadness and hopelessness increased from 2011 to 2021, from 21% of male teens in 2011 to 29% in 2021. Female high schoolers saw a larger increase, from 36% in 2011 to 57% in 2021.
Because I do see a lot of teens that are struggling with depression and anxiety.
Carolyn Mela Makulu is a licensed family therapist. She specializes in teens and children. She's seen more parents and teens seeking her help.
There might be one stressor in somebody's life and they can manage that and they can cope through that. But when you have multiple stressors all around you, that makes it that much harder.
Stressors like the pandemic. The CDC highlights other stressors. New trend data shows teen girls and LGBTQ+ teens experienced extremely high levels of mental distress due to increased exposure to violence and sexual violence. 15% of teen girls experienced sexual violence in 2017. In 2021, that number increased to 18%. LGBTQ+ high schoolers had more experiences of violence compared to heterosexual teens in 2021. School violence and school shootings are general factors as well.
They are dealing with a culture of gun violence that is making many teens feel afraid, and every time there's another shooting, it heightens that fear and that anxiety.
We are at a point of crisis.
Brittany Yelverton is with Girls Empowerment Network. The nonprofit helps teen girls with their self-esteem.
We wanted to equip girls with the skills they were going to need to be change makers in their community.
Through programs like the group's Spark Change Project, high schoolers learn to believe in themselves. Genesis says it not only helped her get better, but motivated her to help other struggling teens and help raise awareness.
I really wanted to be able to support others as well and make sure that they are supported, especially young girls.
Still, the CDC and mental health advocates alike say more needs to be done to help teens with their mental health, especially when Texas ranks dead last when it comes to access to care, according to Mental Health America. Making schools
this is where the kids are.
A critical lifeline for students facing trauma. Jen Porter is the Director of Student Services at Huddle ISD. She says that's why providing faster and easier mental health care for students and staff is a priority.
And so if we can provide quality behavioral health services within the school district, it really just benefits the kids and their parents socially and emotionally, but of course that impacts them academically too.
For parents and guardians, experts say there's a right approach when talking to teens about their mental health.
I think if you go looking for like what's wrong, what can we fix, then you're sometimes going to miss what's actually going on, because sometimes mental health issues don't have a specific cause.
Mental health experts say to keep questions open-ended. Ask how they're feeling, what's on their mind, or if they'd like to share what's bothering them. Also, listen and don't minimize what teens have to say. Now with more confidence, Genesis has a message.
I want girls to know that they're not alone.
And don't be afraid to get help.
Don't stay quiet.
Come on, let's go.
She won't, as she continues advocating for mental health resources.
We need people to support us.
For the KVUE Defenders, I'm Jenny Lee.